All right. Well, welcome everyone. I'm so excited for this episode of The Naturalist. Now, we do not have Adrian Smith today, but as Adrian did to me the other day, we have someone so much better, Bill Giebler. Bill, welcome.
Hello. Thank you. I'm happy to be here.
So happy to have you, as always.
Yeah, it's fun. I've been here a couple times. It's nice to be here. Nice to be back.
This is The Naturalist. In every episode, we're covering the products, ideas, and trends that are shaping the CPG industry.
Or that we just really like.
Okay, Bill, tell everyone, for those who do not know you, who you are.
Who am I? I am Bill Giebler. I am Content and Insights Director for Nutrition Business Journal. So NBJ, we call it, sits within New Hope. But we focus on data and insights, and we focus on the dietary supplement industry. We do go into data and insights around the whole CPG thing, but most of our focus is really on supplements, sort of the who, what, where, and why of supplements. And we put numbers to that, market sizing numbers, plus a monthly journal of really top-notch journalism, diving into the key issues, not really news, but digging into what executives are probably thinking about when they're trying to sleep. So that's what we do.
Trying to sleep. That's what executives do. Try to sleep.
I think so. Yeah.
Well, thanks, Bill. I couldn't really think about anything else after you used the word thing. So
right. Yeah. Right. Yeah. I think that covers it.
So very important work, the data, the market sizing, the insights surrounding the data. And one of the other things that you do is you're co-chair of the NBJ Summit.
With you and with our good friend Tom Art. Yeah. And that's a supreme honor. I love the company, you two, and the rest of the crew that puts that event together. And it's just such an amazing event. So great to be part of that.
And if you don't know what the NBJ Summit is, the NBJ Summit is the premier event for executives in the dietary supplement and nutrition industries. We talk about all of the issues that are facing the industry, align around best practices, how to elevate the industry overall, and really just create great opportunities for networking, peer-to-peer learning, and learning from some of the top experts in the supplement industry, but also in leadership. And so it really is that professional development tied to the space that we work in specifically, but also some of the bigger things happening in leadership as well.
Yeah. Or said differently, it's the premier executive thing in the conference realm.
That is going to be our next campaign around.
I think that'll go far.
You asked me saying it, though. That's really important. So for today, though, our list is really talking about the DSHEA documentary that we developed. Bill, you did such a wonderful job of bringing the story to life of 30 years of DSHEA, because the anniversary is this month.
This week. Right. It's yeah.
Depending on when this goes live.
Depending on when this airs, right.
So tell us about that, Bill. Tell our listeners what the DSHEA Effect is all about.
Well, okay. So the documentary is the DSHEA Effect. So what it's all about. It's interesting what it's all about, because we set out to make, and thank you for that credit. I should throw that back at you too, because we co-produced this. And so thank you for the great work on that too. Help really drafting the storyline as we set out to do this. So DSHEA, the Dietary Supplement Health and Education Act, was passed 30 years ago in October 25th of 1994, signed into law by Bill Clinton. And it's what really has made the industry possible in terms of innovation and what we can and cannot claim, and marketing restrictions, when restrictions are often helpful, right? So in the way that what we can't do allows us to do as an industry what we can do it impeccably and do it with integrity. So DSHEA, we can talk more about DSHEA, but we wanted to celebrate DSHEA. And I think celebrate is a key word, right? Because we didn't want to just say, okay, here's the history, here are the players, here's what they did, here's what made it possible, which would be a great story to tell. It is a great story. But with the DSHEA Effect, we really wanted to say, like, what does it say about the industry today and maybe the next 30 years?
Yes. And that was, I think, the most exciting part for both of us, I think, was being able to say, all right, here's what happens. Here's some historical framework for this and understanding how we got here. But that next 30 years, the next 3 decades, because we have such a strong foundation, because of this regulatory landscape created by DSHEA, we're able to say, what does that give us the opportunity to do next? And how are we now able to innovate responsibly, to really focus on quality and transparency and all those things that matter to so much of our community? So that next 30 years, I thought, was key to the story.
And I love that you inserted the word responsibly in there, because I think it's not just what are the opportunities, but what are the responsibilities of the industry as we move forward. Or said differently, it's interesting to think about, because we often talk about the industry as this monolithic thing, and then there are these bad players. And really, it's what we tend to be talking about at Nutrition Business Journal, at New Hope, among the trade organizations, is the responsible industry. It's kind of the necessary qualifier. And so that's really what we're celebrating, is the responsible industry that came out of DSHEA, where it has us now, $67 billion annually. And what that looks like going into a tech crazy next 30 years, tech crazy next 30 minutes, right? I mean, it's just such an interesting time we're in right now.
Yeah, well, Bill, I want to dig into some of those themes that come up in the documentary, which people will be able to view on newhope.com, on YouTube. We'll have a lot of social content around it as well. But before we do that, so you talked about DSHEA, what it is, and is there anything else that people who aren't familiar with DSHEA should know? You know, one of the things I think is so important is when people still sometimes say the dietary supplement industry isn't regulated, which is not true. And it's regulated by DSHEA.
It's regulated under DSHEA. DSHEA is the legislation under which the FDA regulates the supplement industry. Now, there is some question as to how well it's regulated. And, you know, is FDA putting enough resource into regulating it so that a bigger piece of it is the responsible industry? But yeah, the broader media loves to dig into that, like it's an unregulated industry, which is just factually incorrect.
So anything about DSHEA specifically that you would want to call out, things that either retailers or brands just entering the space should really be aware of? And how do you recommend people get more information about DSHEA if they aren't familiar with the ins and outs of it?
Oh my God, that's a big question. One of the biggest things with DSHEA comes down to claims, what you can say. It gave the opportunity to say what the product does in specific terms, and those terms are not disease terms. So dietary supplements are restricted from using any claims about disease states. And what the opportunity is to talk about structure function claims, which is that phrase comes out as a single phrase so often that I think a lot of people don't even know what that means. Like, is structure modifying function? Like, what's happening there? Structure claims or function claims or both. The structure claim is supports healthy bone structure, right? That's the physical structure of the body. Function is maybe the function of the immune system, supports healthy immune function. So you can talk support. Support is the key word under DSHEA. You can say this dietary supplement supports healthy function. It supports healthy structure, and that's what we get to do with dietary supplements. So that's one of the biggest things is the structure function claims, and the big piece of that is what you can't do, which is the disease claims.
So, Bill, super helpful, because I would imagine a lot of people listening are familiar, but a lot aren't. And so that's really important, you know, especially for early stage companies to really understand, dig into that. Is it relevant to retailers too? Do they need to speak and educate in structure function terms?
They need to be careful not to make disease claims about dietary supplements. So yes, I guess the answer is yes. But it's really when you're talking specific to a product that the structure function claims and the no disease claims are become so important. But sharing literature about the benefits of the nutrients themselves is fair game.
And I think where it comes into play for retailers a lot is by with their vetting of companies and making sure that when they're bringing products into their aisle, into their stores, that those are products that are making accurate and compliant claims. So every category manager and buyer really being familiar with this feels very important. So, and as you mentioned, Bill, there are aspects of DSHEA that people really feel do need to be updated. We don't talk about that in the film pretty intentionally.
Mm-hmm.
Any thoughts on that?
It's really interesting, and it's I mean, there's just so much. I was at the CRN conference last week, a couple of weeks ago, a few weeks ago, Council for Responsible Nutrition, and a really important trade organization, and focused on a lot of the legislative issues. There's other good ones too, UNPA, other organizations. But of course, this is on the agenda every time people gather and talk about these legislative issues. Do we need to open up DSHEA? Do we need to change it? I've heard so many people say no one ever expected it to last this long with so few amendments along the way, or along 30 years. So I think there's a consensus that there's a lot of things that really could be updated. And there's a lot of fear. Be careful what you ask for. Once we open it up, everything's right. Everything's at risk. We might end up changing things we don't want to change. So it's hard to say. But I think one of the things is, the separation. What we call dietary supplements are regulated as food, and that's under DSHEA. Under DSHEA, dietary supplements became food. FDA regulates it as food, not as a drug. And as you can't make drug-like claims, and even having a drug-like function becomes risky. So what's tricky there is, sure, nutrients like vitamin A or calcium, arguably that is food. That's how humans have always received those nutrients, just by eating food. So now that food looks like a little pill or even a gummy or a powder. But what's also in the dietary supplement space where it gets a little tricky is traditional medicines. A lot of the herbal products on the shelf were traditionally medicines, not foods. And now we're just saying, oh no, they're supplements, but it's regulated as food. You can't talk about it as a medicine, even though that's what most of the history of it is. No one was eating, like, what's for dinner, Mom? Echinacea. No, that's not what echinacea is. It's a traditional medicine. So I think in the herbal space is where it gets most tricky.
Yes, and it's reminding me of that moment in the film when Lauren says we were trapped between two worlds, food and drug. Still are, right?
We really still are.
Because we still are in that space, and that creates some ongoing friction that can in part be navigated by potential updates too.
And I think the update, now this is me sort of editorializing. I've heard other people say this. I didn't manufacture this, but I don't know if there's consensus around this. But wouldn't it be great if you could make more medicinal claims about herbs, and maybe you substantiate it in a way? You have to have X clinical trials that meet these requirements, and then you get that becomes a proprietary claim for a certain number of years before it goes out as general. So it shouldn't just be turned on, like, okay, go ahead and make any illness claims you like with herbs. But there might be a way to step into that is full of science and integrity.
And that great point, Bill, because I think that's very much aligned with where a lot of the industry is moving, which is science, 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 leaning into the science, investing in the research. It's one of the big themes that comes up in the film. And so to ensure that companies that are, and this is me editorializing as well, but ensure that companies that are investing in that way and do truly have the science to support their products can also be making claims that are aligned with the results of those clinical studies and all that research. So
yeah, because that research is expensive, and there's a bit of a negative incentive to take on that expense. You can spend all this money, learn this stuff, and then you can't say much about it.
Yes.
And anything you can say about it, so can your competitors. They can say, oh, thanks for doing all that research. My echinacea does that too, So it's, I do think building some structure in there into the into the legislation that would promote that sort of science and then reward those who spent the time and money on that science.
Are there any other themes, Bill, from the film that you think are particularly relevant to the future of this industry and also how we think about DSHEA moving forward?
One of the themes, and it does come up in the film, is personalization. And personalization now for about 10 years has been right around the corner. It's something that is a huge opportunity for the supplement industry. And what that means is sort of, we like to talk about the N of one. So we were just talking about the science of how this benefits people. Historically, people has meant men because that's who gets studied in these studies. Thankfully, there's a lot more science happening around women, female bodies, and finding out how nutrients and herbs affect female bodies. But still, it's women. And, you're a woman, you're Jessica. So what sort of nutrients do you need and how do they work for your body? And so that's what the industry is trying to crack, is to get to that N of one. Or to be honest, it's an N of 1,000. If you could be one of 1,000 women who have this sort of profile versus just all women. And so personalized nutrition is a really great opportunity, whether it's done with DNA testing or other biometrics or, microbiome testing. And ultimately AI, once that data is collected, you can actually bypass a lot of the biometrics, and you can go straight to AI profiling of people, and you can get personalized recommendation. How much vitamin A, how often, what type. And so that's, we don't go into nearly that detail. We just sort of tickle these ideas in the film, but that's a huge opportunity. And it kind of felt like that's going to blow up. That's right around the corner. And then it felt like, oh, no, it's too complicated. It's not going to happen. Bayer bought care of and then closed care of. Like, that's, you don't need to know any more than to say, like, oh my God, personalized is really happening. Oh my God, I guess it's not happening. But I don't think that's a true story. I think there's still a huge opportunity and there's still a lot going on there. So that's a lot about personalized, but that's one of the big things. And it dovetails nicely with AI and other opportunities for the industry.
Yeah, and definitely it seems like some of the things that have happened over the past 1 to 2 years and continue to occur are driving potential real change in that area. You mentioned we've been talking about it for a decade, and haven't seen that real kind of breakthrough moment. But between the awareness and kind of this awakening around the need to invest in research behind all populations, all types of people, all genders, that feels very important, combined with these incredible advancements in AI. Those two things together, I think, could actually lead us to some real progress in personalization, which definitely affects all of these discussions around the future of this industry. You also touched on it. We talk about it in the film and in general around this industry, is this beautiful marriage of ancient wisdom and modern science, and how I think the dietary supplement and nutrition industries in many ways so represent how those worlds can come together, which I think consumers are seeking now. They want to find things that meet them where they are, which is a little bit of a different perspective around personalization, but personalizing decision-making and the ability to work with a holistic practitioner, but also with conventional medicine experts. And I think this industry is doing that really well also.
Yeah, it really is. Yeah. And I think it's safe to say most of the innovation is in herbal. You know what? You could almost say that about pharma too. Most pharmaceutical medicines, or many anyway, are coming from ancient botanicals. I say ancient botanicals with a long history of use. So it's interesting. And that's one of the greatest areas for discovery. And then it bifurcates. There's those who say, let's use the whole herb and let's use it in a traditional way. And then there's the other approach of let's isolate the specific compound that creates the mechanism of action we're going for. And it's almost more of a pharmaceutical approach, but then you have a branded ingredient and then you put that, and both paths have a lot of credence to them, but it's interesting to see.
Yeah, it is. And I agree with you that that's where so much of the innovation is happening. Anything else about the film or about your work in this area? Because you're not passionate about this at all, are you, Bill?
I'm not. Wearables. Back to personalization. One more thing about personalization that's so going to be so crucial to it is wearables. And right now, wearables mean watches, but it's going to mean shirts. It already does in some way. It's going to be clothing, other things that monitor like what's going on in our bodies that help us actually see, did that pill work or did it not? So not just diagnostically, but then, okay, should I eat the Reuben sandwich or the kale smoothie? And then your shirt tells you, reinforces or the opposite, the choice you made. So about the film, I just want to say, I think it was so fun. And you and I had such a great time putting it together. What I think makes the film unique is that we didn't tell the story exactly. We told a different story. We did reach out to the usual suspects in some ways. Lauren Israelson, head of UNPA, Steve Mister, head of CRN, Mark Blumenthal, head of ABC, and those guys were around 30 years ago. Lauren and Mark in the same position they're in today, and very much helping this happen. Greg Horn with Specialty Nutrition Consulting was head of GNC at the time and was instrumental to making it happen. Sandy Gooch, we talked to Sandy Gooch, wonderful human being. What a great opportunity to have her in there. And she ran a major retailer, Mrs. Gooch's at the time. So we had to talk to those. And it was a great opportunity. It was so fun to talk to those people, but also just to not talk about what it was like on Capitol Hill and to talk more about like all the things we've just talked about, what it meant for the industry and what it means for the industry going forward. So that's just one of the things I'm proudest of with the film is that we told a different narrative and a whole different feel from a filmmaking standpoint than just, here's how we made it happen. Here's the senators who did it, and here's what passed it.
I loved that too. And it was interesting as we went through the process. I think we started out like, oh, let's not talk to like the usual suspects. Let's not talk to players and then we were like, we have to, of course, you need to talk to the people who were so influential in this in different aspects through retail, through, helping get it passed, through their work in trade associations. All of those people's voices were equally relevant to this narrative. But the narrative was different. And what I loved about it is it really got to the humanity of it, the why behind the industry, which is the same as the why behind DSHEA. And I felt like that was really kind of moving in a way that I feel like, we're pretty proud of being able to show that side, but with the same people, the different perspectives.
Yeah, exactly.
Well, thank you, Bill. We could chat about this all day long, and we have.
Sure could. We've spent many days chatting about it.
But for now, we will wrap up. Be sure to check out the full documentary. We also have a lot of content about DSHEA, about the issues from personalization to ancient wisdom meets modern science to the regulatory landscape into the future. All of that on newhope.com. And thanks, Bill. A pleasure.
Thank you. Thanks for having me.